Today's guest loves animals more than anything, so much that she studied veterinary medicine and surgery. She founded All Vet Pet Clinic in Hyderabad, and within no time, it is one of the sought after clinics for pet owners in the city. She conducts drives for vaccinations and surgeries and various animal welfare issues to raise awareness and helps treaties and indies. She shares and spreads pet care information and knowledge via her Instagram page, Jasleen Pet Care. As if one passion is not enough, she crochets in her free time, which is mostly at night. She's extremely passionate about anything to do with Harry Potter. She faces immense challenges in her profession, and she kindly agreed to share her journey with us today. Proud to call her my friend, we have with us today Dr. Jasleen Kaur, known to her family as Joan, and I call her Jazz. Hi, Jazz.
Hi. Hi. That was
so
one
much.
of the best introductions I've ever had. Thank you.
Thank you very much for taking your time out and doing this. So I want to start by asking, your family is literally filled with doctors who treat humans. So why the interest in animals?
I think I got my interest in animals because I've always had pets growing up. I shouldn't say pets, now it's pets. I've always had a pet growing up, and she passed away when I was about 14 years old. And I felt very helpless when that happened because I didn't know why it happened. I don't know what we could have done different, how we could have probably saved her. She was just 10 years old when it happened. So that sort of got me more interested in the veterinary side. And I wanted to take my passion and love for pets a little forward and try and help out other people who have pets who are as helpless as I felt at that point, to maybe help them understand what things could have been, how things could have been done different, or how they can manage and take care of the pet in a better way, lifestyle changes that can be made, things like that.
Did you already have an inclination towards medicine in general, or it was just overall because of losing your pet?
It was because of losing my pet. At that time, I had no idea what I wanted to do in life because I was, I think, in 7th grade and I literally had no idea. I used to change my mind every day. But then after that, I made up my mind and I never changed it again. So that was when I knew that, okay, this is my profession going ahead.
Amazing. How was your parents' reaction when you said you wanted to get into veterinary?
They thought I was joking about it. It's just a kid's dream and it's going to change over time. But when that didn't happen, even after my 12th boards, and I didn't write any other entrance exams, my parents insisted that I write a couple of other entrance exams for medical colleges. I refused to do that. I said, I know what I'm going to do and I'm only going to apply for veterinary college, nothing else, because I didn't want any options. And they also insisted that I don't join bio at all. I take maths because that was more of my forte in school. But again, I told them that I want to be a vet, so I have to take bio. My mom tried her best to convince me. Otherwise, she took me to a lot of government hospitals and showed me the life over there. And she said, this is what your life is going to be like. You're going to have to treat large animals. And then I in turn took her to private clinics and I showed her the life there. And I said, see, it can be like this too. There are two sides to it. And after that, they said, okay, you know what? We're not a fan of it, but if this is what you want, sure, your life, your wish. So I really appreciate that. They never stopped me after that.
But it's amazing that you could take such a strong decision at a young age. Generally we are bound to get influenced by their advices or opinions, and that's amazing. What made you want to start your own practice though? Like you said, there were many sides to working as a vet. Why your own clinic?
So I did work with other practices, and even when I was doing my master's, I had it in my mind somewhere that I would like to start my practice eventually, because that would give me a lot more freedom to do things the way I would like to do it. Maybe charge people who can afford it, not charge a little for the rescues, or adjust my charges according to that, adjust my timings according to that. Basically, I wanted that kind of freedom because in the end, I was in the field, I was in the profession to help others. And that is not something which can happen when you're working under someone else. Like, as you said, you had an emergency in the middle of the night and you didn't know whom to call. If I knew that if I was working under someone else, I'm not authorized to give out my personal number. So it's only during the clinic hours that I'm helping out, but even that is going to be based on a set protocol that I'm following. I cannot divert from that. I cannot do my own things in most of the practices because there are rules which are made. And that was not the kind of practice I was looking at. And that was not the kind of boss I wanted to be either. But I did learn a lot by working in other practices. I learned many things the way I need to do them or what I shouldn't be doing. So that was a great learning experience, but that was all it was in the end. It was more like uh, just a learning experience, a stepping stone for me to get where I am right now.
What challenges did you face, Jazz, while setting up your own business?
It's like in any other practice, I mean, in any other profession, I guess, where a few people are pissed with you because you've ventured out and started on your own and they didn't want things to go that way for you. And they try to badmouth you, they try to, you know, pull you down. But as I said, that's a part of any profession. I had a very good support system over here, thanks to my parents, because my dad has been practicing here for more than 35 years. So he was a huge support for me. He literally helped me out at every point, at every step. My mom still helps me with my accounts and everything. So that really helped me big time to overcome most of the hurdles of management. And other than that, I realized that I don't want to put too much thought into gossip or too much thought into negative thoughts which people try to instill in me. So I decided ignoring all of that is the best way to go about it.
In terms of the way you price things, or you treat your patients, vets are often compared with doctors who treat humans. What kind of comparisons do you face, and can you tell us why they're not right in assuming certain things?
We do get to face a lot of comparisons. Like they say, oh, your charges are so much, humans this is what they charge. Or even humans don't charge this much consultation as you do, and things like that. And for that I tell them, why do you need to compare human to pet? If you have a pet in your family, isn't that a part of your family? So if you're okay with paying 700 or 800 bucks as your own consultation fee, why won't you be okay with paying 400 or 500 rupees as a consultation fee for your pet? I mean, you yourself are trying to differentiate between your pet and your sibling or your kids then, which honestly I don't think is right if you have a pet at home, because then it's supposed to be equal. And other than that, I always tell them that you cannot compare it with a human practice, because you go to a clinic, he is going to give you a prescription over there. He's going to refer you to a radiologist to go get an X-ray done, or he's going to go and refer you to a lab and say, okay, these are the blood tests which are needed. You go to this so and so lab, get the blood test done, and then come back over here. Or else he'll tell you, okay, I think there's a surgery that's needed, so I refer you to this hospital. The orthopedic surgeon over there is good. So you go there, get the surgery done, and then we'll do physiotherapy over here, or whatever. So then those are specialists, and they're going to keep referring you from one person to other, from one lab to the other. While in the veterinary practice, it's one person does all, basically, at least in India right now. So if you get your dog to me, whether it's blood tests or x-rays, ultrasound, surgery, pet food, pet treats, accessories, medicines, all of that is going to be covered under one single roof. So obviously the bill is going to come a little high, because it's not just one thing that we're doing, it's everything, including the medication, which can be pretty expensive. So if you compare that to the human practice, veterinary is actually very, very, very cheap. If you were to go get a surgery done or go get admitted in a hospital, your one day's bill would be about 1 lakh easily, or your surgery cost itself would be about 50,000-60,000. No vet charges that much. It's just that because the entire bill is coming in one single paper, that it feels like, oh my God, this place is really expensive. That's what I think.
Some clients do feel like, you can just give a phone consultation without actually examining the pet. They just feel it's easy, it's just a dog. Okay, he or she is vomiting, or he or she is not pooping, or etc. And then they just feel like you have a one-stop shop medicine for a few couple of simple symptoms. What do you have to say about?
What most people don't realize actually is that's illegal for us, basically, to give out prescriptions over a phone call or over WhatsApp without seeing the pet. Even for human practice, in fact, it's now become illegal for them to give out prescriptions over the call. Unless we clearly specify that this is only for an SOS basis, it's just for the emergency basis for today, because I understand you can't bring your pet to the clinic right away. So this is just for the emergency basis. And you will have to take him to any other vet or to us tomorrow or soon for a proper consultation. So this is just to manage till then. And this is not a treatment. This is just for management until then. So that is kind of what we try and do on the call too. But people don't understand that. They tend to get very angry about it, and they're like, oh, you're being unhelpful on purpose and all of that. But we do have to be careful about ourselves too, because in case something goes wrong, then obviously we are the ones to blame. And it's not always as simple as my pet is vomiting, my pet is having loose motions, or is constipated. I'd say you are experienced with that too, with Leo. So it's not always as simple as, oh, he's constipated, give this medicine. He's vomiting, give this medicine. There can be n number of reasons why he's throwing up, why he's constipated. And we're not going to know about those reasons unless and until we have a look at your pet, unless we do a basic examination. Maybe we're going to just check the tummy and see if, he feels pain anywhere at any point. Or maybe we need to take an x-ray and see if there's any foreign body over there. Anything, basically. But unless and until we do a set of things in a particular order, just blindly giving a treatment is never going to work.
Yeah,
that's why phone consults are very tough.
Yeah, they don't realize that how important it is actually for you to physically examine the pet, unless obviously rare cases where you think you can, or the history of the pet maybe, and you know what's been happening. Exactly. Rare case.
Yeah. Maybe like a follow-up.
Yeah. You've written a lot about, that clients do not adhere to professional behavior. Some of them badmouth you in front of your staff, and some of them may blame you that you have high treatment costs. And recently, since COVID, I know that some of them even got upset that you denied checkups for those who turn up without a mask, which is such a basic necessity in the current pandemic. I was wondering how you treat them in that moment. And then again, if they ever come back to you, what's your behavior like towards them?
So sadly, we are under oath to treat them no matter what. Even if they do come back, we have to treat them, especially if it's an emergency condition. There's been only one incidence where I've told a particular client that they're not allowed back in the clinic because they'd come back for a nail trim. And this was after they misbehaved with my staff, sorry. So their pet had eaten something, a foreign body, basically. It was the toy duck kind of a thing, the squeaky thing. And he was under treatment with us for vomiting for a very long time, where we kept insisting over a period of time that, he will need surgery, but they were insistent that there's nothing wrong with their pet and he doesn't need surgery at all. And finally, they agreed for the surgery, and we showed them the squeaky duck which came out from the tummy. And it had been already about a month and a half since he'd been throwing up. And post this, they were like, oh, you guys are really expensive and you're charging us unnecessary amount on a daily basis and stuff like that. So they started going to another clinic, getting the treatment from him, but buying the medication outside. But because they stayed near our clinic, they would come to us with the medication and tell us, this is the medication which he's prescribed. We've already loaded it in syringes according to it. All we want you to do is give the syringe, give the injection to our pet, and we're not going to pay for this because you didn't do anything. We have the prescription, we have the medicine, you're only giving it, so I'm not going to pay for this. And because the surgery was done with us and because the dog was still under recovery, we did not object to it. We went on with it for the next 5-6 days. And once the dog recovered, they actually got a box of sweets and they gave it in front of the entire staff. They made sure my entire staff was there. They gave it there and they said, but this is only for Dr. Jasleen and Dr. Akila and no one else. None of you are allowed to eat it because you people didn't do anything for my pet and I don't want any of you even touching these sweets. And that was rude. No offense, but that was very rude because I know how much my staff does. They're a very important part of my practice. So I very politely told them that, see, now that your dog is fine and everything, we refuse to treat your dog from now on. I'd say that you go back to the other vet where you've been going and getting the prescription, but we're done with this. And they thought I was joking. They came back 2 days later with their pet for a nail trim. And I clearly told them that I'm sorry, but it was informed to you that I cannot treat your pet for so-and-so reason. Either you apologize to my staff or else you go somewhere else. And they got so angry that they made 10 other people write a 1-star review for us on Google. And they told us that they're going to do that. And they literally made 10 other people write us a 1-star review on Google because they felt very insulted that we sent them back. So things like this happen quite often, where I'm not going to name her, but she's a Telugu TV actress, apparently very famous. I'm sorry, I don't watch Telugu movies or shows, but my staff recognized her. She came in with her pet and she said, either you do all of this for free. It was a surgery. She said, either you do this for free or I have a lot of contacts. Within 15 minutes, you'll have at least 100 negative reviews on Google, and I'll see who comes back to your clinic. So
Just like
we've
that.
received a lot, just like that.
No,
Because she wanted to surgery
nothing.
for free.
She just wanted a surgery for free.
Yeah.
Will she act for free?
That's what I asked her. I said, would you do your work for free? And she said, you have no right to behave like this with me. You don't know who I am.
And she has a right
So,
to behave that way with you.
apparently she does, because she's a film star or a TV actress. I don't know. That's a daily part of it, which we get, like we usually get a client like that on a daily basis. But now we've stopped caring about negative reviews or about blackmailing and everything. I did in the beginning because I was just starting out and I didn't know what to think about it, what to expect out of it. But now I'm like, listen, if people want to come back for the way I'm treating their pet, let them come back. Otherwise, I cannot keep bowing down to you and your whims and fancies just like that.
You spoke extensively about how a lot of your social media followers send you messages regarding emergencies. And if something happens to the pets before you get back, you get blamed and are made to feel guilty as if it's your fault their pet suffered or died.
Yeah.
Why do these people behave like this and how do you deal with them?
I tried telling them, I'm like, listen, if I did not reply to your message, or even if I did reply, that's beside the point. If your pet is actually in the middle of an emergency, would you really spend time messaging someone on Instagram or on WhatsApp, or would you actually give them a call or directly take them to a 24-hour hospital? I mean, who's to blame over here? If someone in your house, a human being basically, was suffering with something, would you actually find someone on Instagram and try messaging them and asking them what to do? Would you take them to Yashoda, Apollo, or Care as soon as possible? It's you are to blame if something's happening to your pet during an emergency because I didn't reply to them to your message on Instagram. That's insane. And then I get blocked. So,
all these challenges we just spoke about, do you think all male vets also face these challenges, or do you think maybe some of them directed towards you because you're a woman?
I'm sure male vets face them too, but less than what a female vet would, because people find it easier to bully females than they would if it was a male, any profession. In fact, they've always thought females are an easier target or a soft target, and they can just push us into a corner and scream at us and go away because it's against a woman's character to scream back or abuse back or whatever. So
all kinds of doctors who have a conscious feel that your patient's life will always come before your own. What kind of pressure does that create in your mind?
A lot, to be honest, because initially, especially even now, if I have my clinic phone with me, I cannot put it on silent. I know if I have my clinic phone, even if it rings at 2 a.m., 3 a.m., 4 a.m., I will have to answer it. I will have to be available for my clients. We are not a 24 hours clinic, but still, if someone calls and insists it's an emergency, we have opened the clinic up for them. We have gone back to the clinic for them in the middle of the night too, because in the end, I know I'm going to be, even if they don't blame me, I'm going to have it on my conscience that, you know what, maybe if I just gone back or done something, probably could have helped the pet, probably could have done something. So that always is a huge pressure, even when you're doing a surgery, even if it's a very simple procedure. I tell my staff that if the client is more anxious about it or more emotional about it, which obviously you're right, because everyone's attached to their pets. But if they show it out to us and start being really anxious before the surgery and, tell us again and again, please make sure nothing happens to my pet. Please make sure. That adds on to a lot of pressure. Even a simple, basic procedure which we do on a daily basis can become extremely tense in the OT, where you're like, oh my God, there's a lot relying on this case right now, and I have to make sure that nothing goes wrong with this particular pet. So
does it get better over time, this stressful feeling, or it's the same every single time?
It's the same every single time, because no matter how many surgeries you've done, each pet is different and each pet owner is different. So it's always the same, because at least for me personally, it's always the same, because I wouldn't like to take any particular surgery easily and be like, this is a regular thing I've done a million times. I mean, it's okay. It's just going to happen like this. Even if I tell that to the owners, in my mind, I don't want to be like that. I don't want to take it easily because I know that anything can go wrong at any time. They can react different to the anesthesia. There can be something going wrong internally which I'm not aware of. Whatever. So complications can always arise. So I need to be prepared for the worst case scenario for every surgery, no matter how routine it is, no matter how many times I've done it in my life. That's again just my personal view on this.
You also repeatedly spoke about and you shared on your Insta pages that how vets show high statistical rates for suicides and suicidal tendencies. Could you tell us why that's the reason? Why do you guys have such a high statistical rate?
We have to do everything. So if you bring in a pet which is not doing well and which needs to be euthanized, which needs to be put down, we have to do it ourselves. And we also have to be an emotional support for you, the pet owner, to help you get through it, to help you understand how it is done. And as soon as we do that, as soon as the euthanasia suppose is done, we immediately have to come out of the room with a smile on our face and go treat the next patient. Because if we don't have a smile on our face, the next owner can get offended that, this vet is a very grumpy vet or whatever. So it's very challenging having to deal with different emotions in such a small period of time. Like 1 second, you're helping an owner cry out their feelings. You're putting down a pet which you've probably treated their entire life, the pet's entire life, and you yourself are attached to a pet too because you've been treating it on for so many years. And putting that pet down is emotional for us too. And immediately coming out and talking to someone else about something very casual, asking them about their day maybe, or laughing at a joke which they say, it can take a toll over a period of time. Plus, as vets, we get to hear a lot of negative things on a daily basis. I've had threats, I've had people come and tell me that I'm absolutely inhumane because I'm charging to treat a voiceless animal, because I'm making money out of a voiceless animal's misery. And I've actually had a person tell me that because you've charged for my cat who is suffering and who cannot speak for itself, and you're making money out of my cat's misery, I pray to God and I'm telling this on your face that you're never going to be happy in life. You're going to die single and lonely. And that's not a good thing to be told on your face. It's a very, I don't know, it can be very,
Hurtful.
very upset, very hurtful when someone says something like this. And being told things like this on a daily basis is again something which takes a toll on you. We've had clients who come in who are like, give us 5 minutes, I'll just put my dog in the car and then I'll come back and clear the bill. And they leave and they never come back. I have dues of close to 6 to 7 lakhs right now, where clients have not come back and paid their bills. And we can't do anything about this. There's no security system in place for us. There's no insurance policy in place for us. So we can't do anything. And if we want to have a good practice, if we want to run a proper practice where we can ensure a good treatment, we need to invest in a lot of equipment. So just setting up a nice practice with good equipment would cost a minimum of 50 lakhs. So taking a loan for that and then repaying all of that on EMI basis and still getting to hear things about how we are overcharging for no reason, or how we are making money out of a voiceless animal's misery or things like that. I would say most of the vets do suffer with mental health issues because of such things, because we get to hear such negative things about ourselves on a daily basis that you end up questioning yourself in the end. And it will eventually catch up with you. Maybe eventually, once it crosses a limit, it just might seem easier to put an end to it rather than deal with it on a daily basis. Because we do have a lot of bills to pay, a lot of salaries to pay, a lot of EMIs to pay. A vet practice, unlike a human practice, cannot function on just a doctor and one person sitting outside and sending the patients inside. We need at least a couple of paravets helping us, because sometimes one dog needs 3 people holding him down to give one single injection. Then we need someone who will help out with the lab. We need someone who will help out with the pet shop, someone with for the reception, billing, someone for the pharmacy. So that's a lot of salaries that we have to pay in the end. And also for clinic, one single room is enough for a human practice to run their clinic in. For veterinary practice, we need a much bigger space because we need a lot of equipment. We need a space for operation theater, for an X-ray room, for a lab, for the OPD area. for a grooming parlor. That all of that is a lot of money, a lot of investment.
How can we help, or what can we do for vets in general to not feel like that, to help them?
I would say people need to realize that we are not charging you unnecessarily, or we're doing this because we need to meet our daily expenses. We're doing this because to give your pet the best possible treatment, to give your pet the best possible diagnosis or services, we have to charge that much. Otherwise, you need to be prepared to go to a government hospital and be okay with the treatment which they're doing for a 10 rupees fees which you have to pay. And don't come to a private clinic if you have to complain about the charges. And people need to really stop using social media as their personal diary where they can just vent out for no reason for one small thing that goes wrong according to them. That they may think it's just one review, they write it and then they forget about it, but that one review sticks with us for years because we keep going back to that and we keep thinking about what happened, what went wrong, and why did we get that one particular review. We work very hard to try and get some positive feedback, even if it's just a verbal feedback. It doesn't have to be written somewhere, but even a verbal feedback, a verbal thank you means the world to us, and we work very hard for that. Most vets, most doctors don't have a personal life, because if we have a clinic home with us, we're constantly answering calls, constantly talking to them, and one person in the practice is always on call where they need to make sure that they're somewhere close by so that if there's an emergency, they can come back and attend to it. And all of that is a lot for a person to take. So try and understand that a little maybe and be a little more supportive rather than just getting angry for small things and venting out immediately. Or maybe have an honest conversation. If you think you were overcharged, try and find out why that you were charged for that. Or if you think something went wrong, try and talk to the vet and see why it went wrong, what could have been done wrong, done a different way, or something like that. If that doesn't work out either, or if your vet is like, I don't want to discuss this is what it is, this is what you just can't question me, then maybe think about social media.
All these challenges we just discussed, but you did went on to say that given a chance, you do it all over again. What makes all this worth it?
The few clients who are actually grateful for things which have gone different. When we see a case which we thought wouldn't make it, or which we thought was pretty bad shape, get better and then come back to us for a general checkup for some other reason, or just come to us just to meet us, that makes it all better.
They're saying hi or bye, the way you interact with the clients or the patients. Doing this on a daily basis, it's really hard to maintain that friendly face kind of atmosphere. Not just you, I think you make sure your entire staff is like that. Why did you choose to be different? Because I'm sure not many clinics are like that, whether it's for humans or vets. They might have started off with a passion, but it just goes to a stage where it becomes mechanical, like a daily duty kinds. You come at certain time, you go at certain time, but you make it a point that it doesn't go there. Why?
So there are two reasons for this. Talking to the clients and trying to understand them, I've learned from my dad. I've seen him the way he is with his patients. He knows all their background story about their families, about what's happening with them. And every time, even if we run into them in a hotel when we are out for lunch or dinner or wherever, if we run into some of his patients, he makes sure he asks about their kids, about what they are doing and how their studies are going, or whatever's happening in the family. And that always used to make me question him and be like, why do you know so much about your patients' families? And he would say, listen, they trust me. They've been coming to me for such a long time, and I'd like them to feel comfortable with me, comfortable enough for them to come back to me and for them to share things, because it's all about the history about the patient. They may think this is a very small thing and it doesn't matter, but it's all about the history. And when they're comfortable with you, they'll start talking about things. They'll trust you enough to talk about it. And that's where you can find out a trigger. You can find out what probably could have caused what's happening, and it'll make you a better doctor. So that, I think, has helped me a lot with my practice. So I always try my best when a client comes in, especially the first time when they come in, to make them feel as comfortable as possible, so that they're not like, they don't go back with more questions than they came in with. And it doesn't matter if they take 10 minutes or half an hour, 45 minutes of my time. As long as I feel like I've done justice to all their questions, as long as I feel like I've answered everything that they had in mind. And if they are relaxed, the pet can sense that. Their pets are very good with sensing feelings. So if they sense that the owner is relaxed, the pet will relax too. The pet will also calm down. And that makes our job easier to examine the pet, to maybe do a basic procedure or blood test, temperature check, whatever it is, if the pet is calm. So,
do kids who are brought up around pets, do they have any different behaviors than those who are not brought up around pets? And, is having pets in a family household sort of a therapeutic experience? Does it help their mental health?
definitely. There have been studies done on this too, in fact, where they say that kids and babies who are brought around pets, they're less prone to allergies, first thing. Their immunity is a lot better when they're around pets. They learn how to share a lot more than kids who are not brought around pets. Because kids also have this thinking, okay, I'm eating this, my pet likes it, they're just going to give a little piece of it down to the pet. So that teaches them the whole sharing behavior, whether it's with food, whether it's with space on the bed or space on the sofa, but they tend to learn how to share things better. And it also makes them happier. Kids brought around pets have been shown to have fewer mental issues than kids who were never around pets.
What's the difference between this kind of therapeutic experience and actual therapy dogs or therapy animals?
Therapy dogs are trained to sense emotions way better than a normal pet would. Like therapy dogs will actually be there with you, will support you through things, through your emotional ups and downs. So that is for cases where you are in a risk of maybe suicide, or you have horrible mental issues where you definitely need that support at all times. That is where the therapy dogs come into play. Plus, of course, for people who cannot see or people who can't hear. So the different kinds of therapy dogs who are trained in different ways, and they can help you out with that. But that is a whole different dimension for people who are in that phase. But just kids in general, or people who are going through a phase of mental issues because of things which are happening at home, because of things which are happening at work or in their personal life, whatever. In those cases, having a pet helps a lot. It's like just a calming thing for you.
A lot of exotic breeds available here whose native weather is drastically different from ours. Not only do they breed them excessively, but also sell them at a much higher price. A lot of people buy them only as a status symbol and end up tying them outside near the gate. What are your thoughts on this?
So I'm not very opposed to people buying breed dogs, because you can't stop everyone. But as long as you do justice to that breed, say if you have a husky at home, if you can afford to buy a husky for 70,000 bucks, you can definitely afford to have an AC room for that husky 24/7, especially in Hyderabad weather. And if you're doing that for the husky, if you're making sure, okay, husky is staying in an AC room at all times, and you're giving the husky enough exercise, like making him run for a good 7-8 kilometers, giving him the proper diet which is needed instead of giving dal chawal or curd rice, go for it, get it. But if you're just getting it to tie it near the gate and show people that, oh, I have a husky, and they go, that's why it's near the gate, whoever's passing by can see the dog and be like, oh, these people must be fancy, they have a husky. Makes no sense. A husky is not going to live a proper life. He's probably going to die a very bad and early death. So for those people, I try to counsel them at work too in the clinic, but it barely ever works, because you can't change a person's mindset. If that is what they want the dog for, you can't really change the person's mindset. So I think for that, we need to have stricter laws in India, where the breeders need to be kept in check, so that we know which breeders are authorized to sell that particular breed and which breeders are not. Maybe bigger fines, or putting them in jail for a period of time, so that they're also scared about it. And then the breeders need to have a particular set of guidelines as to what background checks they need to do, or what other checks they need to do after selling the pet too, so that the pet can have a better life, the pet can lead a normal life, which it would in a different climate. But we're a long way from that in India.
Yeah. A lot of people think it's funny to feed pets a little bit of alcohol or blow smoke onto their faces and wait for them to feel the high. In reality, the
Yes.
reaction may have less to do with feeling high and probably more to do with discomfort and trauma. What do you say about this, Jazz?
It can be a lot to do with feeling high too, because their capacity, I'm saying capacity here, but their capacity is a lot lower than what yours is. They are not going to process the alcohol or process the drugs, for lack of a better word, in the same way that you do. And just a little amount of that is enough for them to, for their body to cause toxicity and for them to react really, really bad to it. We have seen cases of marijuana toxicity in the clinic. We have seen cases of alcohol toxicity in the clinic where pet owners thought it was just funny to do it. And we've had pet owners come in and I'd be like, listen, you're not allowed to give your pet alcohol. And be like, no, my pet is used to having one peg of whiskey every night. He's totally fine with it. And I'm like, no, you are used to having one peg of whiskey every night. Your pet is not. You do have no idea what damage you're doing to your pet over there. And I said, when was the last time you've done a blood test for your pet? Oh, never. Like, how do you know your pet is taking it well? Let me do a blood test right now and I can prove otherwise to you.
There's comparatively increased awareness regarding adopting pets and not buying them nowadays, but there's still a lot of taboo on adopting indies or mixed breeds. Firstly, can you let us know why adopting is important, and then how do we spread the awareness?
Adopting is very important for, again, a couple of reasons. First, because it will stop the backyard breeding which has been happening. So backyard breeding is basically where small breeders who have two dogs with them, one male and one female, whatever breed, say a Labrador with them, and they decide that they want to make some extra money. So they keep mating the female lab over and over and over again every time she comes to heat, and they just give her enough food so that she's surviving on it, because they don't want to spend too much money on that dog. And as soon as she has the litter, the pups are about 25, 28, 30 days old, and they sell the puppies because they want to make quick money and they don't want to spend too much money on the puppies. They don't care if these pups survive for long. They don't care if these pups have good immunity. They don't care if these pups die of parvo or because of the constant breeding, if they have any genetic defects. They don't care about any of that, and no one's there to keep a check on such things. So that can stop. And also these breeders, they only breed to the point where the male is able to produce viable semen, and to the point where the female is able to produce a good number of litter. If the litter number comes down, if the female goes from giving birth to 5 pups to 1 pup, that means she's not able to produce as well. They either leave the dogs outside just to fend for themselves, which means they're going to die on their own out on the road, of course, because they don't know how to fend for themselves, or they starve them to death because they're done with these dogs. They don't want to use them anymore. So adoption is going to stop such things, or at least reduce it to a huge extent. It's actually illegal for people to sell puppies. Like, even if I was to meet my dog, there are laws now which prevent that. But if I still mate my dog, or if it's an accidental mating, I cannot sell them. I need a breeder's license to sell those puppies. Again, no one checks such things. So there's a lot of backyard breeding which is happening in India, to an extent where there's so many dogs which die of starvation because they're no longer useful to the breeder. So that can be kept under check by proper adoption. Second thing is, there's so many strays on the road, and there are people who complain every time about, oh, there's many dogs in my area and I want someone to do something about it, come pick them up or whatever. And they get run over by cars, they die of starvation. You can give those dogs a life too. If you want a pet, if you are a genuine pet owner, what difference does it make to you if you're taking a husky, a lab, or an indie? A pet is a pet. So maybe you can save a dog's life this way. That would be another reason to adopt. And third reason for me is, indies are a lot more durable than breed dogs. Definitely a lot more durable. They have amazing genes. They don't fall sick as often as breed dogs do. They don't have as many issues as breed dogs do. Also because they've not been constantly inbred for our needs, like pugs, for example. Pugs have been inbred to an extent where you name an issue and pugs have it. Skin issues, cardiac conditions, joint conditions, respiratory issues because of that snout which they have. They can't breathe properly. The eyes are bulging out, so they have a lot of ocular issues. Everything, you just name it and pugs have it. So indies don't have such issues. That way, you'll actually end up spending a lot less on vet bills if you have an indie with you.
A lot of people give their loved ones a pet, as if it's a commodity, and a lot of others abandon pets without proper research, before buying. They don't understand the full responsibility that comes along with the fun side of having a pet. Later in the pet's life, they don't want to give the necessary care or money and then go to vets for euthanizing, like you were just mentioning. Firstly, I want to know, is it allowed to euthanize a pet just because you feel like you don't want to take care of it anymore?
It's not really allowed, but at the same time, sometimes there is no option. If the pet is not getting adopted, there's no shelter as such which is going to take it in. And the only option is the owner leaving it on the road or euthanasia. Then what option do you have left there?
So
A
the
pet
owner
which
has
is
to
built for.
leave them and go. Like they don't take ownership of the dog anymore.
Yeah, we've had that happen to us too, where the owners came in the late in the night and said, "Oh, we're traveling. It's like an emergency, and we need to leave our pet with you for the night. We'll come back tomorrow evening. We'll clear the bill tomorrow evening, and we'll take a pet at that time. It's an emergency. We're very, very sorry, but we have to do this." And we said, "Okay," and we kept the pet with us because we have boarding too. And next day, when we called the owners, they said, "Oh, we've shifted to Indore, and we no longer needed the pet. We had no place to leave it, so you can do whatever you want with him." And this was the friendliest Labrador I've ever seen. A very healthy, very friendly Labrador. But they said, "We don't want to spend the money it takes to transport the pet to Indore." And we had a flight and we had to leave urgently and we didn't know what else to do. So we figured, you're a vet, you can take care of it or do whatever you want with him.
I wanted to know if the friendly or aggressive nature of the pets, does it depend on the way they're brought up?
A lot. It depends on the way they're brought up and it also depends on their parents. So if in case the parents were also a little aggressive, then that gene obviously does tend to pass on to quite an extent. But
One second,
with proper
parents is not pet parents, right? You mean the actual
pet parents.
birth parents of the pets?
Yeah, the pets. Yeah, exactly. The pets' parents.
My bad. Yeah.
Yeah, parents. Yeah. So that can sometimes be controlled with behavior management and training. Other than that, I have noticed personally that dogs which are, which for whom there's crate training which is done, or dogs which are tied up most of the time, like, they just got them as a guard dog. They tend to be more aggressive than other dogs because even in Rottweilers and Doberman, which are inside the house as a part of the family, always open around people, tend to be a lot more friendly than Rottweilers and Doberman, who are as puppies itself tied near the gate because they need to instill the thought that you are guard dogs and this is where you're going to be and you're going to guard. They're not around people. Not many people approach them. No one plays with them, spends time with them. They end up getting a lot more aggressive than the dogs which are always around people and open.
Is it healthy for pets to sleep in your room, hygiene wise, or be around kids?
As long as your pet is groomed properly and regularly, you're brushing his or her teeth on a regular basis, and making sure all the vaccines and deworming and everything is done regularly, why not?
I know you recently took to providing food for COVID affected families and even fostering young kids who lost their family due to COVID. This is just a gesture from your side of service as a good Samaritan. Where do you get the urge to do stuff like this, be so positive?
Uh, it was basically because I felt very helpless when COVID started, and I had no idea what I could do to make things better, to help out the people who were suffering. And also because every time I opened social media, every time I opened the newspaper, it was just negative things about people dying, people in the hospitals, about their bills, and about how they're suffering to meet those expenses and things like that. And I'm not at a stage where I can help financially in any way because I'm just starting out myself. So I kept thinking about it and I thought the only way I can help out is probably by providing food, by providing shelter. So that's how the idea came into my head.
Thank you, Jazz. I want to end this by asking three normal questions that I want to ask everybody. One word that resonates with you.
Passionate.
Why? A particular reason?
Because passion has always been something that's driven me right from my childhood. It was passion towards pets, passion towards finding out what I could have done different to save my first pet that led me to where I am right now. And even for starting my own practice, it was passion towards helping out with the needy ones with rescues that made me start my own practice. So that's always been the driving factor in my life.
One thing you wish you had done differently?
I'm usually of the feeling that I don't want to have any regrets. I don't want to have anything that holds me back or go back and think about it. But I guess one thing which I regret to do, one thing which I wish I'd done differently would be I would like to study more when I had the time. Now I feel like going back to studies is a very tough thing for me. I probably should have done PhD when I was still in the zone.
Do you feel like you
I
need
enjoy
that
teaching.
particular degree now in your professional life?
I enjoy teaching a lot. I always have. Even in college, I used to help out my juniors with their exams, with everything. And if I ever decide to get into the teaching line, I'll need a PhD. So I'm going to find it a little difficult to go back to that now. But I think I sometimes regret that because I would love to teach.
One last question. One advice which you think is important to everybody?
Just follow your heart. I know it's something which is very lame and everyone tells that to you, but literally just really
Maybe
follow your heart.
everyone
Don't care.
says that, but I don't think it's lame.
Because everyone does say that. I mean, don't care about what your parents are going to tell you if you follow your heart, if you follow your passion, what your friends are going to think about you. I got judged to the core because back then when I said I wanted to do veterinary, it was a joke. No one took veterinary seriously at that time. No one had that kind of a connect with pets. Pets were more like घर में कुत्ता है खाना खिला रहे हैं हो गया that's it. No one is going to spend money on that kutta. That I mean, in all honesty, that is how it was when I was growing up too. My pet was also never taken to the vet that often, probably why things went bad for her so soon. But I was too young to understand all of that at that time. And I got a lot of negative crap. I've had people, my own cousins, come and tell me, ओ तू वेटनरी करेगी तो तेरे से तो कभी कोई शादी ही नहीं करने वाला है जानवरों के डॉक्टर से कौन शादी करेगा तू तो जिंदगी भर अकेले ही रहने वाली है. Then I've had other people come and say that, you know, you're going to be financially dependent on your parents the entire life. You're going to be a burden for them your entire life because you have no career. You're only going to live off them and then you're going to live off your husband if anyone decides to marry you. And I've had a lot of crap like this being told to me. But I knew this is what I wanted and I stuck with it. And I'm very happy now. I'm really happy with my decision that I did not let any of them dishearten me or didn't let any of them change my mind about what I wanted to do in my life. So that's why I think follow your heart is actually the biggest or the best advice that I can give anyone.
And we pet owners are happy that you've become a vet today. Thank you so much, Jazz. Wish you so much positivity in life and hope that you keep doing what you're doing.
Thank you. Loved your questions.